Welcome to The Agenda.
Another doctor is facing 50 years in prison. Talk about this and more today on The Agenda.
What's on the agenda today?
What agenda? 2030 agenda.
What's the ultimate agenda?
Is there an agenda?
Global agenda.
It's run by people with agendas.
It's crunch time in this whole agenda.
Everybody has an agenda.
With all the current issues on our agenda.
It's my agenda for you.
Courtesy of those people and their agenda.
What really sets the agenda?
What's number one on their agenda?
So, what's on the agenda for today?
The next subject on the agenda.
Welcome to The Agenda. I'm your host, Edward Zoll. I'm here with Dr. Ron. I always have such a hard time with Dr. Ron's last name, but welcome to The Agenda, sir.
Thank you very much for having me. So
We just met, actually. I feel like I've known you for a long time.
Yeah.
But Dr. Ron, I was put in touch with you through Dr. Kirk Moore. And for the Died Suddenly, The Agenda audience, they will remember that last July, the whole community went in to try to rectify a very, very terrible situation. Dr. Moore was facing 35 years in prison. His trial had begun, and no one knew about the details of it. And no one knew that President Trump and Attorney General Pam Bondi had the ability to shut it down. And guess what? Truth be told, the community came together, and they intervened and stopped it. Well, Dr. Kirk Moore reached out to me after you cold called him, and he forwarded the case to me and said, "Hey, Ed, I think that we need to go for round two." So you've been fighting this for about, is it correct to say 4 years, actually? 4 years, because it's begun in 2022. It's right when we came out with Died Suddenly, actually, the film. Dr. Ron, could you tell our audience, take us from the beginning. First of all, you are facing 50 years in prison because the Biden administration came after you for what they alleged was Medicaid fraud. 5 counts.
Medicare fraud.
Medicare fraud.
Yeah.
5 counts. Altogether, maximum 50 years. And actually, this went to trial. You're going to tell this whole thing. Jury found you guilty. The judge, for many reasons, threw that out and wrote a scathing 93-page report, entered into the court, and vacated it. The Biden administration, before they left the White House, left this country for all their intents and purposes, they resurrected it, put it into motion, and now, under the Trump administration, you're facing a new trial in August of this year.
Correct.
All right, take me from the beginning here.
First the dinosaurs came. No, just kidding. So I opened up an urgent care center in 2016, and I'm an emergency room doctor, and I opened up my own business, and COVID was on the horizon in 2019. And I could see the writing on the wall. So I started to prepare for what was coming. And because of that preparation, which was a lot of work and a lot of logistical hurdles, we were able to really become the largest testing site in this county. And then we grew from 1 site to 8 sites very, very quickly. We had about 6 employees before the pandemic. And at the height of the pandemic, we had over 300. And we grew very, very quickly because we were really the only game in town for testing. And then once monoclonal antibodies became available, which really represented the cure for COVID, I became a very outspoken proponent of using them. And I went on multiple national and international news outlets, Fox News, Breitbart, Newsmax, Sky News. I was being interviewed at least once a week and talking about how wonderful these drugs were and how we really should be using them. And I began to question the vaccine narrative. I started to say, because at first I was very pro-vaccine. I thought this was a great technology and this is amazing we could do this. And then it started to click that what they're telling us doesn't make any sense. They keep moving the goalposts. And then this vaccine for all narrative really didn't make any sense. All of a sudden, it's the only virus in the history of the world that there's no natural immunity to. Like, that didn't make any sense to me. And I began to question that. And then, for whatever reason, the Biden administration, in my estimation, and as far as I know, the only time in the history of medicine, politicized the monoclonal antibodies, and then started to use DEI initiatives to determine where they were going to send them. Which, before that happened, there was no problem. There was no shortage. If you remember, again, this medicine is really the cure for COVID. Everybody had it. Florida had it. Wyoming had it. Every state, they could get it, no problem.
I remember Florida, Ron DeSantis, our governor, championed it.
Yeah.
And it saved hundreds of thousands of lives in my state.
Absolutely. And then all of a sudden, when the Biden administration decided to federalize it, all of a sudden we faced shortages. And to your point, Governor DeSantis had a hard time getting it because they started to use, again, for the first time that I know of in recorded history, they started to use equity as a reason for distribution for a medication, for a life-saving medication, not need, equity. And they got between the doctor and the patient and said, well, it doesn't matter what you think, doctor, we're going to decide where this medicine is going to go based on equity, which makes no sense whatsoever. And I started to call that out. And then they really made a foolish decision towards the end of December in 2021. They went on and they said, well, once the Omicron was surging at the time, and they said, once that surge reaches a prevalence of 70%, we're going to shut the program down because they said that the monoclonal antibodies that we had at the time were not effective against Omicron, which I questioned. And I said, that, first of all, I don't even know that that's true. And even if it is true, you don't know what variant this person has. And you're taking away, again, you're getting between the patient and the doctor, and you're taking away that person's informed consent. Because even if it was true that didn't work, let the patient make that decision.
I remember this time because actually this program, in its first kind of form, is called Crosstalk. My co-host, Lauren Witzke, who was back in Florida, as I come on assignment out here in Maryland, our first episode was on Omicron because it sounded like a transformer. And it kept transforming. The goalpost kept transforming. And I remember this because, yes, they started trying to curtail our access to things which were actually working, which were actually, changing the curve and stopping the spread and all this other crap they kept pushing. But yeah, I remember this time.
Yeah, and it was the cure for COVID. And it also really obviated the need to get vaccinated because you could now cure the disease.
And that was the key. When you started speaking out, Dr. Ron, and at the time, I believe we actually did cover one of your sound bites.
Oh, really?
Yes, very interesting. And it is because, again, it's undercutting the Biden administration's very zealous push to put a jab and a booster in everyone from my grandma to my 1-year-old niece.
To your infant child.
Infant child. They wanted to put babies and grandmas and everyone in between. Yeah. Boosters, shots, and it was going to be the endless solution. But as I said, it gets undercut when you realize there are things like the monoclonal antibodies.
Which again, really was the cure for this disease. I mean, the efficacy was amazing. I've never seen anything like it in medicine. So I went on Fox News, I went on Newsmax and a couple of other
big agencies.
Big agencies, thank you. And I spoke out. And I think the words that I used on Fox were that they're going to kill people. And I called it the height of bureaucratic arrogance, which it absolutely is. And you know what? I would do it again today because it made me mad. And they were just putting people's lives at risk for needlessly. And it turns out I was right because 2 weeks later, the government came out and said, oh yeah, they never apologized, by the way. They never said we're sorry.
They don't ever apologize.
And they never faced any consequences. I know it's awful, but they said we misread the data by a factor of 50%. The prevalence wasn't 70%, it was 20%. Now, only the government can make a mistake like that. I don't know how anybody with any common sense could misread the data that badly. But regardless, they allowed us to go back and infuse. And I just want to say, we were the largest infuser in the state of Maryland. We were bigger than Johns Hopkins. We were bigger than University of Maryland. We were the largest. We were doing hundreds, almost close to 1,000 people a week across 3 sites. And we did this because it was so efficacious and it was saving people's lives, literally saving people's lives. You could turn somebody who was on death's door and within 24 hours, they were 80% better. I've never seen anything like it in medicine.
Well, the problem with the success story, this close to the Capitol, where they were pushing a completely different narrative, is that it makes it a really hard sell up north and anywhere in the country for that matter with these kind of numbers. So, of course, after you spoke out a few months later, you faced indictment.
I, out of the blue, with no warning, no phone call, no email, no, nothing. Just, I find out, I wake up in the morning. Just imagine that nightmare. You wake up one morning. Literally, I was driving my 3-year-old to his gymnastics class. That's when I found out. And I'm a very active father. I have 4 kids. I do a lot of things with my kids. Every week, I would take my son to his gymnastics class and we would play together. And that's when I found out that I was indicted. And completely just your life just turns upside down in an instant. And it is the worst experience you could ever imagine. And they had really done no investigation. They just came at me with a sledgehammer they got my name wrong and all the paperwork.
That's right. It's not just me who can't say his last name, apparently. We got your first name wrong.
They got my first name wrong.
The last name's fine. The first name. Okay, because this. I know Biden and his lackeys were not very smart, but they got Ron. Okay.
And they gave me a middle initial. I don't have a middle name.
Oh, okay.
And, you would have thought that if they had at least done a real
Remember
investigation.
someone else they had done it.
Yeah.
No.
I tried that. My lawyer said, no, I'm sorry. That's not going to work. They never talked to my partners, and they were the guys that ran the business. I was the medical side
partners, and they said, yes, they went out the wrong. Okay.
Yeah. And they subpoenaed my personal email account, my Yahoo email, but not my business email, which I used to communicate with all my providers and all the nurse practitioners and PAs. And I think the real thing that's shocking to me was they said that we were upcoding. So we were charging too much, essentially, using the wrong codes. But the only way you know that is to look into the charts. And the only way you can get the charts, when you submit a claim to an insurance company, you don't submit a chart. You just submit the patient's name and a bunch of codes. If the insurance company wants to see the charts, they have to ask for them. And that's called a chart audit. And they'll send you a letter and they'll say, could you please send us, 50 charts or whatever. And they'll give you the names of the people they want. They never did that. So they indicted me without ever looking into the charts upon which the coding is based.
They didn't even look at the evidence of which they were like, see, this is, I say, typical weaponization in government. Luckily, we're not seeing this as much anymore, but this is the kind of thing we are hearing about from the plight of the J6ers and others who are facing prosecution. In Dr. Moore's case, same thing, same story to a degree, and the same practices under the Biden administration appear to be very corrupt people. Now, before we get further into this, I do have to pitch to one of our sponsors because, again, the reason we're able to do a lot of these things is because we have the great support of several great companies in this country. One of them is GoCo. Here again, how you can protect your wealth here from GoCo.
The last time President Trump was in office, gold went up a whopping 51% and silver went up 53%. Now, people who purchased gold and silver in 2016 are very, very happy they did now. I believe that time is again now with the current trajectory of the Trump administration and the prices of gold and silver. I don't think you should wait. Make sure you go to stolenliberties.com. If you sign up for a qualified account and let them know that we sent you here at Died Suddenly, you can get up to $10,000 in free bonus silver. I purchased gold and silver over Christmas, and I got a nice chunk of extra silver with my purchase, and you can too. Just let them know that Died Suddenly sent you. Don't miss the opportunity of a lifetime. Don't wait. People in 2016 who purchased are surely glad they did. Don't miss it here in 2026. Go to stolenliberties.com. You can support our podcast, and you can support Edward and I's work as we continue to expose the truth about the COVID vaccines and our big project this year where we prove to the world that God is real. Go to stolenliberties.com.
The agenda.
Dr. Ron, the story of what you've gone through, it will one day be a movie. I said the same thing to Dr. Moore. Now you guys can do the movie together because it really is. It seems cartoonish to the degree that this has moved forward. But the thing that's not a joke, we have such joyous. We don't let these monsters and these tyrants break our will. But the thing that's not a joke is they really did move forward with this. This has cost you real money, okay? I don't want to say a number. Your lawyers will tell you not to say a number because maybe one day they're going to be able to pay you back on this. But the point is, it's been an extreme amount of money. Multiple homes, cars, college funds. Yes. Same with Dr. Moore. Pick it back up here. Tell me more about what happened after the indictment came out and you started heading to trial for the first time.
Yeah. So, to your point, it's not just the money. It's a game changer. I'm a very happy person. I'm a very glass half full person. I was as close to suicide as I've ever been in my entire life.
My goodness.
I've never contemplated that ever, and I would never do it. But that was as far as I've ever gotten. I used a the badness scale, if you want to say, like, on the top of the badness scale is the loss of a family member. This is just below that.
Oh, yeah.
That's how much this traumatized myself and my 4 children and my wife. Like, you cannot describe it. I didn't sleep for 2 years. My wife barely slept. My kids weren't sleeping. It was just awful. But I didn't do anything wrong. So I said to my lawyers, I said, look, what are my options here? And I wasn't going to plead to something because I'd have to raise my right hand and commit perjury, which is a crime.
Yeah.
If I was going to plead guilty to something that I didn't do. And I wasn't about to do that. So I said, I'm going to trial. What are my options? And they said, well, really, they said 2 types of people go to trial: innocent people and crazy people. And we don't think you're crazy, so we should go to trial. So we went to trial, prepared like crazy. I didn't work for 2 years. I really focused on the trial and my defense, and we went to trial, very nerve-wracking. And the entire time I'm sitting there thinking, my God, like, where's the evidence? What are they going to show that I did?
Well, the judge was wondering this too.
Yes. So the first day of trial, the first witness they call is the guy that they built their whole case around. And he stands up there on the witness stand, and my lawyers completely destroyed him, not using slimy lawyerly tactics or anything, just using facts. And he fell apart completely, and he had no idea what he was talking about. It was so obvious that was the case, because he had to backtrack on a number of things, and that the judge dismissed the jury, called us all up to the bench with the jury outside the courtroom, looks at the government, waves his finger at him and says, what the hell are you doing? Where is the crime? Those are his exact words. It's in the transcript.
Wow.
And the government said, oh, you'll see, Judge, it's coming, there's more. And he said, well, you better show me something soon, because I'm about ready to throw this case out. And he didn't. But the whole time I'm sitting there listening.
Obama appointed judge, by the way.
Obama appointed judge.
This is government lawyers, AUSA, part of the COVID task force, fraud task force. Obama appointed judge said to this group of government servants that we pay, you have no case. And what are you doing here? This is an embarrassment for me too.
Yeah.
Carry on.
Yes, exactly. And so it goes to sitting the whole time, and I'm just, where's the evidence? What are they going to present? And I'm thinking, okay, they're doing a good job of making me look like a dirtbag, because that's what they do. They make you look like you're the worst human being on earth, but there was no evidence of any wrongdoing. So it goes to closing. And the crazy part that I think is that the government gets to go last. They're the ones bringing the charges. You should get to go last. But anyway, they go last. And the government lawyer says to the jury, he said, and basically the whole thing came down to, we were billing at a certain billing level, a certain code.
Code 4,
level 4. And the government said that wasn't right, but they never said why it wasn't right. And they never said what the right number should have been. They just said I was wrong, which is a crazy argument, right? It's so ridiculous.
And in your case, you presented, actually, a letter was written in your case by the people that actually came up with the code. So that it looks like actually no rules were broken here in regard to the coding.
Well, and we called an expert who not only was like a wonderful expert, but he was the president of the Professional Association of American Coders, the American Association of Professional Coders, excuse me. And he said, I've looked at hundreds of your charts and they all look perfect. In fact, some of them may have been undercoded. The government, by the way, looked at a total of 5 charts. We saw over 100,000 patients in that time frame. They looked at 5, and they never had a professional coder look at those 5. It was just the government attorneys, and they never said what was wrong. So yes, and then the group that writes the coding rules, the AMA, I'm not a member of the AMA, have never been a member of the AMA, came to my defense and wrote an amicus brief, which is a friend of the court brief, and they said, basically, they're the ones that write the rules, and they said that the rules weren't broken. But yet the government, yeah, I would think so, but the government still came after me. So anyway, at closing, the government lawyer says, you may be asking yourself, jurors, what's the right level? Should it have been a 4, a 3, a 2? He said, it doesn't matter. You just need to know that he's wrong, meaning me, and he's a criminal. And then, because everything else that they'd said had been shot down, all their other theories had just been completely eviscerated, they said, you know what, jury? The defense put on a defense, and they showed all these charts, and they had experts come in and testify, and it's very complicated. They're just trying to confuse you. I'm telling you this.
Confuse you with facts.
Right. They said, use your common sense. And I think that resonated with the jury, because none of this makes common sense. And that is an absolute truth. None of it makes common sense. But had we been able to rebut them, I would have gotten up there, my lawyer obviously, and said, okay, well, when was the last time you filed a tax return? Like, does that make common sense? Could you use your common sense and say, hey, IRS, I used my common sense to deduct this or that? No, you can't.
Well, it doesn't make common sense to steal a father from a family and from a community he served during a time of emergency and peril. It doesn't make common sense to spend millions of dollars, because the government said, to go after someone who just so happened to criticize the sitting leader of the country. So, okay, jury, and there's a whole other thing we probably will eventually get into here this year. But I'll just say this, I don't trust juries anymore. And it's so in your case, the jury of your peers, not doctors, not people even from your own community, just people who maybe didn't want to get out of jury duty. They didn't really have a day job. They kind of fallen asleep looking at their iWatch. This actually happened, by the way, during the case. They came back with a guilty verdict. They did. All right.
Worst day of my life.
Devastating, right?
Devastating. I literally fell to the floor.
My gosh.
And I'm not a dramatic person. I could not get off the floor.
Sure.
It was horrific. And then with the drive home, the sentencing was going to be later, so they let me go. And my wife's driving home, and like the car ride home, I'm just like a mess. I'm just crying everywhere, and like my kids are in the driveway waiting for us.
My God.
And they had no idea.
They had no idea. You wanted to tell them?
They said they could see it in my face.
Oh my gosh.
And I mean, just the
Your kids are
worst.
smart kids. I met your kids. They're very smart kids.
Thank you. Yes, the worst possible experience ever. But then almost 4 months later, right before Christmas actually, my lawyer calls me up and says, we want to talk to you. And he says, I want to get the whole team on the line. Is that okay if I call you back in 5 minutes? And when the lawyer calls you, it's never a good thing. And I'm like, oh God, what horrible.
Sometimes.
Well, what horrible thing is happening now? And then he says, I want to call you back. And I'm thinking like, my God, it's like me saying, I have your biopsy results, but I'm going to go put the chicken in the oven. I'll call you back in 10 minutes. I'm like, you don't want to hear that.
No.
Anyway, he calls me back and he says, Judge Berdar, we just got Judge Berdar's 93-page opinion. And I'm thinking, and he, sentenced me to more time or whatever. And he said, and he acquitted you completely. And I had locked myself in my office because I didn't want my family to hear what horror show I was about to hear. And then I screamed and my wife came running in and she's like, are you okay? And I was crying hysterically. I couldn't get the words out. I'm like, that was acquitted. Happiest day of my life.
Wow.
Happiest day of my life. And for the first time in almost 3 years, I slept. I slept that entire night.
Oh, wow.
And I woke up and that whole just weight was just off my shoulders. I've experienced like I've never had in my entire life. It's amazing.
That's incredible. Well, of course, it didn't end there. It did not end there. Before we get into the last part of this story, I want to share with our audience the last sponsor. Actually, they also help with sleep. They just got done with a trial in the United Kingdom. It is, of course, Masterpiece. And if you take this, the zeolite inside of this product, it helps cleanse out a lot of the heavy metals in your body. And it actually helps give you clarity, gives you brain strength, and again, sleep at night. Let's hear a word from our sponsor, Masterpiece, and we'll be right back.
My name's Jesse Beltran. I'm the current president of an organization where our brand is Mind Nexus Live. I've been one of the leading investigators with the phenomenon called Havana Syndrome or anomalous health incidences. I have been covering this since 2010. I am currently a certified technical counter-surveillance measures expert. I have been the lead in doing what is called nonlinear junctions scanning on individuals. And this process started in the United States. Initially starts with an RF detection, and then we verify it with a nonlinear junction depending on our findings. And basically what we're finding is those who are symptomatic were lighting up at very specific focal areas around the human body and coming up positive for whatever reason for semiconductive or silicon-based materials in those areas. And that's what the nonlinear junction detector is designed to do. And we've recently started a study where we're testing non-symptomatic individuals here in the United Kingdom. They are also lighting up in those same areas as the symptomatic individuals, and that had not been the case prior to that jab. Prior to the jab, those who were non-symptomatic, almost 100% of the time, came up negative. They were coming up pretty much what I would expect a symptomatic person to come up positive. Very high, a lot of areas around the human body hitting at 100%, where the nonlinear junction detection indicated there was silicon-based materials. They had been put on a test basis or a trial basis of Zeolite Z, or the Masterpiece product. And quite frankly, I was really surprised coming here and doing the secondary exam on these individuals who participated in the testing. There was significant reduction in the areas that were lighting up.
So the results have been absolutely phenomenal and actually better than we could ever have expected. An average reduction across the board so far, and we've got one more day of test results coming in, of 80% reduction of these radio frequencies coming off people's bodies. We've had personal reductions of some people of 98%, but on the whole, it's around about an 80% reduction. Now this is unprecedented because usually in clinical studies, if you were to get a 30% reduction, that is something that people are very happy to see.
This is why, for the first time in 20 years, 15 years specifically, out in the public, that I've supported anything out there. And so this is quite promising. Yesterday was very emotional for me because I never thought that I would see this. I can tell you 100% of the time post-COVID, I've not tested anyone who did not come up positive in the right, left TMJ, the dorsum, occipital portion, and the base of their neck. And for the first time after they've been on this trial, they are not lighting up. And we are seeing anywhere from 75 to 85% reduction in the findings. And this is quite frankly incredible. Right superior shoulder. 95%.
The agenda.
All right, Dr. Ron. You just got the greatest Christmas present ever.
Yeah.
All right.
Yeah.
The lawyer, or let's say the judge, becomes Santa Claus. All right. This is an amazing day. But it didn't end here. You had been acquitted, and I'm sure this ticked off AUSAs, ticked off the Biden administration, especially because at your trial, there were more government lawyers from the Department of Defense, HHS, all the different branches under Biden. They were at your trial instead of doing work.
Watching.
Right?
Sitting in the gallery watching.
A lot of people
Waiting
invested in
time.
this. Okay. And after December of 24,
Yes.
all right, when did you find out that the Biden administration had one last parting stab in the back waiting for you?
So I forget the time frame, but they had X amount of time to resurrect the case, to appeal it. And literally at the 11th hour of the last day, they appealed it.
11th hour being like right before President Trump's inauguration.
Yes, right before President Trump's inauguration. So weeks before, they're literally packing their bags and walking out the door. And they know that once the case is started, it's hard to stop it because there's inertia and, no one's paying attention because they have thousands of cases in the Department of Justice and it's just another case.
Yeah.
So they know that by starting that, they can stab me in the back and just be vindictive. And you're right, they don't like to lose. And this was their parting gift to me.
So when did you find out that you would be facing a new trial?
President Trump was inaugurated in January. I think I found out a few months after that.
Golly. Okay.
I can't remember exactly. Maybe it was August. It might have been August. I'm sorry. I don't remember the exact date.
No,
it's all these dates. It's such a horror show and they blend together.
They didn't just resurrect the trial. They resurrected your trauma.
Yes, exactly. And by the way, not only did this courageous judge, by the way, who really didn't have to do what he did. He could have just said, I thought he was innocent, but too bad. He really took a stand and did the right thing. And I applaud him for that.
Oh, 100%. And I've talked to a lot of legal experts and, of course, even your friends, family experts here. This has never been seen before.
Yeah, no, it's like
never been seen before.
So he
93 pages? I mean,
the Supreme Court doesn't write 93-page opinions. And not only did he acquit me, but he granted me a new trial in case the government appealed. And the 93 pages is just riddled with digs at the government and how poor their case was and how awful it was and how it should never have been brought. I mean, I'm paraphrasing, of course, but I mean, there's a quote in there of like, the government didn't carry its burden and no reasonable jury could have so concluded. The way the evidence weighed so heavily against the verdict that it would be unjust to enter judgment. I mean, it just went on and on and on. You could just quote him all day long about just the things that he was quietly digging at the government for, like, why would you bring a case like this? And, but yeah, they resurrected my trauma and my family's trauma, and now I'm facing a new trial in August.
Well, we are not, and you have not been taking this laying down. Next week, here in Annapolis, there's going to be a lot of action. And of course, the call to action is for President Trump and Attorney General Bondi and anybody who has their ear. We want you to tell Don to free Ron, to save Ron, to stop this. And how we're going to do this, we're going to host a rally. You're going to see a rally next week. Dr. Ron's going to be on a lot of big shows. You're going to be seeing Dr. Ron. You're going to get sick of seeing him. Hopefully he's on so many places that President Trump gets tired of hearing this and just says, look, this is hogwash. The same kind of thing that was done to him, to President Trump, the same weaponization, government lawfare, the corruption in the system. The same thing's happening to you, sir. And look, we are not going to stand idly by as it's done to another good family doctor.
Well, thank you, Ed. And I want to say, your point is spot on. And I think to your viewers, like, if they could do this to the President of the United States, why would they not do it to me? Why would they not do it to you? And why would they not do it to you? If they can do it to the most powerful person in the world, why wouldn't they do it to you?
And they will do it.
And they will.
They will do it.
That's why this is so important to put an end to this, because this is ridiculous.
We have to reform the justice system in this country. That's where it's going. In this case, we have to stop this very clear, blatant example of lawfare. Because if a precedent is made and this doctor is allowed to be put away for 50 years, not only does this community lose one of the great healthcare providers here, okay, there's an example now. There is a victory for evil. And in so many ways, the same group that treats, I'm talking about the lawyers now that treat these cases like it's like a football season, all right?
W's.
It perpetuates the system of corruption. We must defeat this. We must raise awareness to the facts of this case. And again, if you support this, you've watched through this whole episode, this whole very, very crazy story. You hope this ended, right? My goodness, I wish I wouldn't have to keep bringing these stories to you about the doctors who stood up for patients and stood up for saving America during the very chaotic pandemic and the vaccine mandates. I wish I didn't have to keep telling you that there are still cases that are happening, but that's the reality. I'll tell you, if you care, please tell Don to save Ron. And the way you can do this is, Doctor, can you share your website?
Yes. It's www.ronelfenbein.com, RONELFENBEIN.com. And I have a whole bunch of links to other shows that I've done, and there's a Give, Send, Go on there, which, if you can, please, I would very much encourage people to give if they can. As you said, this has been ridiculously expensive and nearly bankrupted myself and my wife and our 4 kids. And there's also a change.org an online petition we're asking people to sign. It doesn't cost anything, but we're asking people to sign it to also help send a message to the DOJ. Like, there's a lot of people out here who want this to stop. And one more point I really think is important is, like, during COVID, the people who came after me hid in their basement. Okay, they hid in their basement. The courts were closed, and I don't need to disparage anybody who works in the court or the judge, but the prosecutors weren't at their job. They were hiding in the basement. I was putting my life on the line every single day. What kind of message do you think it's going to send when the next pandemic hits, when they come after people like me and try to throw me in jail for what at worst is just a billing dispute, versus just picking up the phone and saying, can we have a conversation? Do you think anyone's going to want to fight the fight as a doctor and put their life on the line?
They're not.
This is the thanks we get.
They're not going to do it. And just, I want to bring this up because you did mention this. The craziest part about the government's case, many crazy parts, while the government was alleging this massive fraud case against Dr. Ron, they were actually still employing his services in another contract. Please explain this. So they're saying this man is the most evil, corrupt, criminal doctor in the world. And then also, please set an example how to set up clinic for us, okay? Please do this.
It is. You can't make this stuff up. So the Department of Health and Human Services of the federal government reached out to me And they said, you're really good at this monoclonal stuff. Could you help us set up a site right outside of FedEx Field where the Washington Redskins at the time played football? And I said, absolutely, I'd love to. So they basically paid for everything. And I set the whole thing up, ordered all the equipment, staffed the place, ran the place. And we did it in partnership with HHS and the Maryland Department of Health. We basically went into business together. And they were I said we should test here too, do COVID testing. They were very much against that. And I convinced them that I was right, because I said, look, we can take somebody who tests positive, who's sick and needs to get treated, take them from their car. They show up to get tested. We have them go back to their car and wait in their car until the results come back 15 minutes later. Take them right out of their car, put them right in an infusion chair, and cure them of their COVID right then and there. And the government was like, oh my God, this is the greatest thing I've ever seen. In fact, so much so that they took it and it became the blueprint for the entire country. So the concepts that we developed set up for the rest of the country for all the monoclonal infusion centers that the government had anything to do with throughout the entire United States. And yes, your point is very well taken. Would you go into business with someone that you think is stealing?
No.
It's insane.
It's insane. And look, you set a standard of excellence and respect to this. This is the kind of service we want to encourage, not discourage. And I tell you, from speaking to your friends, your family, you can learn a lot about how a person really is in private by speaking to friends and family. That's why I came out here, by the way. I didn't know Dr. Ron. I got to meet him. I got to look him in the eye and say, Dr. Ron, what really happened is, doesn't make any freaking sense. And what I learned is I found you're an incredibly honorable man, and you're exactly the kind of doctor I will come to for help. So you never have to. We live a very stressful life. Who knows what's going to happen to me? But I'll tell you this. I know what's going to happen for you. The whole died suddenly community, the whole medical freedom movement is going to get behind you this coming week. All right, pay attention. I'm thinking it's going to be Thursday. Pay attention. We're going to have a very exciting live stream. We're going to have a press conference. And you're going to see Dr. Ron's face everywhere. And I have a feeling that we are going to have a difference here. We're going to make a difference for Dr. Ron. We pray again that the Trump administration does the right thing, ends this trial, lets this man get back to his family and get back to his patients and to the country he loves. God bless you, Dr. Ron. It has been a pleasure.
All mine. Thank you very much.
We'll see you next time on The Agenda. God bless you. Take care.
Thank you for being part of The Agenda.